Hello, my name is Erica Black, and I'm a registered nurse at Southeast Iowa Regional Medical Center. And today I will be going over the joint replacement class with you. Preparing for your surgery. So today we're going to do education on understanding the procedure, surgery preparation, your surgery day, your initial recovery, your hospital stay, the rehabilitation, discharge planning, and recovering at home. Understanding your procedure. Talk to your physician. Learn about what to expect before, during, and after surgery. Ask about the admission process, the types of anesthesia, the implant that will be used, the length of your hospital stay, rehabilitation, and pain management. The hip joint. This is just a picture of what a normal, healthy hip looks like versus a hip that has arthritis. And here is a picture of a total hip replacement. The knee joint. Again, this is a normal, healthy knee and what a knee with arthritis looks like. Total knee replacement. And here is a picture of the implant. The shoulder joint. Here is a picture of a normal, healthy shoulder and an arthritic shoulder. Total shoulder replacement. And here is a picture with an x-ray of what a shoulder replacement looks like. Becoming stronger before surgery. You can do exercises before the surgery to increase the strength in your arms and legs. This will make your recovery time after surgery quicker, easier, and more successful. These exercises include ankle pumps, heel slides, seated heel slides, quadriceps knee extensions over bolsters, and they can be reviewed in the packet that was given to you at the office. It's important to remember, stop the exercises that cause severe pain, perform the exercises slowly, rest as needed, complete 2 to 3 sets of 10 reps 2 or 3 times every day. Preoperative tests. Clearance for surgery. Your preoperative tests will be completed before you are cleared for surgery. These will include blood tests, chest x-ray, an EKG, a nasal swab, and a urinalysis if your physician requests it. Results will be reviewed by the pre-admissions nurse. Abnormal test results will be given to your primary health care provider immediately. All test results will be reviewed by your primary care provider to determine if you are in optimal condition to have a joint replacement surgery. An appointment for a physical examination will be made by your primary care provider if you don't already have an appointment. Pre-admission nurse interview. This will include a medical and surgical history, home medications and surgery-related medicine instructions, any advanced directives, pain management, before and after surgery instructions, and any questions or concerns. The day before surgery. Expect a call after noon informing you of your arrival time. Your arrival time is usually 2 hours before your surgery time. You will be reminded to check in at the day surgery registration. Enter through the main entrance and take the elevators to the 2nd floor. Surgery day. When you arrive, while maintaining your privacy, your nurse will interview you, review your paperwork, perform a skin assessment to ensure that you don't have any rashes, bruises, blisters, or open wounds. When you arrive, we will take your vital signs, start an IV, arrange for any testing if needed, answer your questions, and ensure you are comfortable. Your comfort is very important to us. Anesthesia. Your anesthesia provider will discuss anesthesia, pain, and nausea management with you, answer your questions, and discuss the best type of anesthesia specifically for you. Most common types of anesthesia are spinal and general. If you are a total knee patient, they may administer a nerve block in your leg to help alleviate your pain after surgery. The nurses will carefully monitor that extremity after you begin ambulating, since the extremity may be numb for approximately 8 to 12 hours. Your surgeon will discuss the procedure and your concerns, will verify and mark the surgical site. The operating room nurse will then interview you, check the chart for accuracy and safety measures, answer your questions, and escort you to the operating room. Your family will be escorted to the day surgery waiting area and talk to the surgeon when the procedure is done. Post-anesthesia care unit. Your initial recovery, you will be moved from the operating room to the post-anesthesia care unit. You will be monitored very closely by specially trained nurses. You will receive oxygen, IV fluids, pain medication, a continuous heart and respiratory monitoring until your anesthesia wears off sufficiently. A dressing will cover your incision. You may also have a drain tube extending from your incision. If you have hip surgery, you may have a pillow between your legs to prevent dislocation. You may have a Foley catheter to drain your urine, and you may need some blood tests and x-rays. Visitors are restricted to prevent the privacy of other patients. You may receive oxygen through the tube under your nose. Nursing and respiratory care service staff will place a monitor on your finger to measure the amount of oxygen in your blood. Foley catheter. A catheter drains urine from your bladder through a narrow tube inserted during surgery. It is usually removed after your first physical therapy session. A knee immobilizer. If your surgeon orders a knee immobilizer, it will be worn mainly at night to help knee extension. Preventing blood clots. To help circulation, your legs may have white elastic stockings or plastic sleeves that attach to a machine called sequential compression device, or an SCD. Coughing and deep breathing. You will be asked to cough and deep breathe throughout your stay. To deep breathe properly, inhale as deeply as you can and hold while you count to 10. Repeat 5 times. Preventing blood clots. Continue wearing those white compression stockings, otherwise known as TED hose, at all times. Continue to elevate your leg. Do ankle pumps frequently, at least 10 per hour. They contract calf muscles and simulate walking. And you may have a medication to take depending on your medical history. Preventing pneumonia. This is a picture of an incentive spirometer. You may notice this at your bedside after the procedure. Respiratory may work with you post-op with this. Pain management. The type of pain you have before surgery is different than the pain you will have after surgery. You can expect pain after surgery. We use a 0 to 10 pain scale, so you will be asked frequently to rate your pain, 0 being no pain and 10 being the worst pain you could ever imagine. Types of pain medications include IV. We typically use morphine or Dilaudid. You may have what's called a patient-controlled analgesic pump, or a PCA. This will allow you to control when you receive additional pain medications. And oral medications. You will be discharged with oral pain medications. PCA pump, usually discontinued 1 to 2 days after surgery. You will be weaned off the IV medications and given oral tablets prior to discharge. This will ensure your pain is well controlled before you are sent home. To be proactive with managing pain, make sure to ask your nurse when you can have your next pain medication, especially if you do not have that PCA pump. Ask for pain medications before periods of activity, like before your physical therapy. Ice is an elective method of controlling pain and swelling. Your hospital stay. This is just a picture of one of our acute care rooms. When you are in your hospital room, you will meet your nurse and have your vital signs checked. Your nurse will check your dressing and your Foley catheter. You may have those SCDs or TED hose. You may need a blood transfusion, and you will receive blood thinners to prevent blood clots. Early mobility and ambulation. The same day of surgery, nursing staff may help you get out of bed and into a chair. There are several benefits to sitting upright and moving soon after surgery, including preventing complications. Expect to walk the same day of surgery. Day of surgery or morning after surgery. A physical therapist and an occupational therapist will elevate your function and strength. You will get up and help and walk with a walker, most likely. You'll receive help dressing, using adaptive equipment as needed. You will have physical therapy twice a day and occupational therapy once a day. Wear athletic or supportive shoes. Wear a robe over your hospital gown, and your participation in therapy is essential to your successful recovery. Your physical therapist will teach and help you gain the best physical function possible. He or she will improve your mobility, such as walking and using stairs, teach exercises to strengthen your arms and legs, and give tips and techniques for making your activities of daily living easier and safer. Your occupational therapist will teach you and help you do everyday activities after surgery. He or she will help with bathing, dressing, and grooming. Shoulder replacement patients should wear shirts over top of their immobilizers. Do not wear clothing underneath the shoulder immobilizer. Social work will help arrange for any assistive devices you will need prior to discharge. Precautions. Knee replacements. Do not place a pillow under your knee. A pillow may be placed under the calf only. Hip replacements. Do not cross your legs. Do not bend from the hip more than 90 degrees. Don't turn your toes inward. Hip precautions should be maintained for 4 weeks after surgery. Goals for discharge. Average length of stay. A total knee replacement, 1 to 3 days. A total hip replacement, 2 or 3 days. Goals for discharge. Activities of daily living independently or with the help of equipment or caregiver. Car transfers as needed. Home exercise program. Increasing your independence. Independence getting in and out of bed. Steps and walking with a walker, crutches, or cane. Discharge planning. Along with your surgeon, your therapist make recommendations for your discharge plan. A social worker will work with your care team to make arrangements, and arrangements will be made for you to return home when you are ready or to transfer to a rehabilitation facility for additional therapy. Some patients qualify for home health care for blood draws, dressing changes, and physical therapy. A case manager. Oversight of care. When you need help at home, and they help coordinate with social work when medical equipment is needed at home or if you need to move into a skilled care facility. Time for discharge. Your care team will review your discharge plan with you and your family. The team will also obtain authorization for extended care from commercial insurance carriers, ensure bed availability at a facility of your choice, complete the patient transfer process to the rehabilitation facility, or set up home health or outpatient services if necessary. You'll receive prescriptions for pain medication and a blood thinner, written discharge instructions about dressing changes, follow-up appointments, medicines, outpatient therapy, and signs and symptoms of infection. Ensure a family member or a friend is available to take you home. A total knee replacement surgery can be scheduled as an outpatient or an inpatient status for insurance reasons. Your admission status will depend on your overall health, home environment, and your insurance. If you are scheduled as an outpatient and do not meet discharge criteria, your admission status can change. Your admission status can also impact insurance payment. If you are scheduled as an outpatient, many insurances pay for the procedure differently. If you have any concerns about your insurance payment and you are scheduled to have a total knee as an outpatient, we can arrange a visit with a financial counselor to discuss your estimated insurance payment and your cost. Recovering at home. When you get home, continue your home diet. Continue to follow those precautions. Knee patients will have physical therapy 2 or 3 times a week, and hip patients, walking is the best therapy. Continue wearing those TED hose on both legs until you are walking more than sitting. Pain control. Don't let your pain get higher than a 4 or a 5. Take medications at intervals and take it 20 to 30 minutes before therapy. Elevate your leg to reduce pain and swelling. Apply ice 4 times a day for 20 minutes at a time, especially after exercising. And narcotics can cause constipation. You may use mild over-the-counter laxatives such as milk of magnesia or stool softeners. Fluid intake and proper diet will help return your digestive function to normal. Until your follow-up appointment, don't drive a car, participate in sports, return to work, or take a bath. If you have home health care, it'll start within 24 hours of the hospital discharge. You must meet specific criteria for skilled care, and a personalized care plan will be developed along with your physician's orders. Things to know. Remember to consider family or personal issues or concerns. Do you want to go to a rehab facility or home after surgery? And the selection of rehabilitation facilities. Tell your physician if you have had or are having any dental work before or after your surgery. 4 weeks for dental cleaning and 6 weeks for implants or root canals. You may be asked to have a dental exam before surgery to ensure you don't have any abscesses or gum infections. If you have had or are having a colonoscopy within 4 weeks before or after your surgery. Plan. Remove any dermal implants before surgery. Ask your piercer, primary care provider, or a surgeon about removal. Remove all jewelry and piercings, and remove fingernail and toenail polish before your surgery day. Prepare. Don't use any denture adhesive on the surgery day. Shower with the antibacterial soap the night before your surgery and use the bath wipes you received as directed. Take medications as instructed with only a few sips of water on the surgery day. Remember, do not eat or drink anything after midnight before your surgery, and avoid alcohol and tobacco products for at least 12 hours before your surgery. If you have any questions or concerns, please call the nurses in the pre-admissions office at 319-768-3006.
I am here to talk to you today about your inpatient hospital stay after you have your joint replaced. Your hospital stay will be based on several factors. There will be communication between yourself and family members, as well as the doctors, the nurses, social workers, and therapists. If it is deemed necessary that you need to attend a skilled level of care after your stay here at the hospital, this will be decided between that group of people as well, and this will help you optimize your physical therapy and your mobility outcomes. As far as physical therapy goes, myself or my colleagues will be coming into your room to make sure that we keep mobility and maintain mobility throughout your stay. Our first visit will actually be with you on your very first day, the day of your surgery. We will help you with getting in and out of bed. We will help you with your big exercises and activities. Walks down the hall, up and down stairs, perhaps in and out of a car, on and off of a chair. We will also help you with your exercises. These exercises will help with mobility, as early motion is best. We will also help you regain strength. The exercises that we will show you will need to be performed a couple times a day, nice and gently, not to increase pain, but to help with motion and strength, as well as your ambulation. Our friends in occupational therapy will come the day after your surgery to do your evaluation. Occupational therapy helps with your everyday activities, such as getting yourself dressed and bathed. They will help you maneuver around a kitchen or around a bathroom. In addition to those exercises and activities, they will help you get yourself dressed, which may require the use of some instruments or gadgets, which they will bring and help you with. One of those is a sock aid. This is an example of that, and they will help you get your socks on. Another example is this long-handled shoe horn, which will ease the possibility of getting your shoes on if you don't have someone to help you. And the last piece of equipment I have is the reacher, which will help pick up objects off the floor or just out of arm's length. Occupational therapy will come to your room 1 time a day while you're here at the hospital. Upon your arrival at the hospital, a social worker will be assigned to you. That social worker will help you get any pieces of equipment that are deemed necessary for your success upon discharge. They will help you with the pieces of equipment to help get your clothes on, as well as the reacher or the grabber, and also the walker. Early mobility is best, as moving will help aid in your recovery. Getting your range of motion will help with your outcomes. Initially, you will walk with a wheeled walker, and as you progress, you will graduate to a cane. Our ultimate goal is that you will be able to ambulate as you were prior to your surgery. It is very important that we get your motion back as soon as possible. After your total knee replacement, it will be very important that you attend outpatient physical therapy upon discharge from the hospital, as this should be scheduled 1 to 2 days after your discharge. Outpatient physical therapy is important as it will guide you through appropriate strength, range of motion, and ambulation. This will be done 3 times a week on average and will last several weeks until you have returned to your prior level of function. Again, discharge from outpatient therapy will be based upon you, the surgeon, as well as your physical therapist recommendations. If it is necessary that you have physical therapy come to your home, social work will be able to help set this up. I am now going to demonstrate some exercises that will help improve your outcomes. So the first exercise, most basic, is to gently pump your ankle up and down. Go through the full range of motion, make sure to avoid pain. This is going to help contract the muscles of your calf as well as to keep swelling out of your lower leg, and it will also help with the motion of your ankle that may become stiff. The next exercise will be to help with the motion of both your knee and your hip. You will just slide your ankle along the bed in a gentle manner. Go up as far as you can, nice and slow, and then push your leg down as far as you can, extending both your knee and your hip. Again, this will help with the mobility of your new joint. It'll help keep blood flowing and muscles pumping to avoid stiffness in the joint. The next exercise will be the initial exercise for strengthening up the muscles after the joint replacement. We're going to focus on this big muscle called our quadricep, which is in the front of our thigh. You're going to contract this big muscle by pushing your knee down into the bed. Nice gentle hold for 3 seconds and then relax. As you tighten up the muscle, it will also help extend your knee. Our last basic exercise will again focus on strengthening up the big thigh muscle, our quadricep, but now it will be through a range of motion of the knee. With your knee propped up on a bolster, you're going to gently extend your knee straight and then return back down to the bed. As you do this, your knee is moving through a slow and gentle range of motion while the muscle on the top of the thigh is contracting. Please note, this is the only time that you may rest with something underneath your knee. Your arms. Then you will step forward with your surgical leg, making sure the heel strikes first. As you push weight through your legs, also push weight through your arms, taking pressure off of your surgical leg. Then bring your non-surgical leg forward. Push the walker forward and bring your surgical leg forward, putting pressure through your arms again, pushing the walker forward as you do so. If you are having a total hip replacement, there are a couple of considerations you need to be aware of. First, we do not want the angle of the hip, your thigh, and your side to be less than 90 degrees. As I sit in this chair, I am above 90 degrees. If I were to bend forward or sit in a shorter chair, my angle will decrease. This increases the risk of a hip displacement. Please make sure that you are aware when you stand up to use your legs and the arms, if you have them available, to stand. Likewise, when you sit back down, Keep that angle greater than 90 degrees. Another precaution is crossing your legs. Do not cross at either your ankle or your knee, as this motion will increase the risk also of a dislocation. One last thing to consider, as you are standing and turning, make sure you do not pivot on your foot. Instead, move your feet to turn. This will also help to avoid a dislocation.
Hi, I'm Stephanie Riley, a registered dietitian at Southeast Iowa Regional Medical Center, and I will be discussing nutrition for post-op healing. To start, we will discuss the key nutrients for importance of nutrition for wound healing. Our bodies require increased nutrients during the healing process. These main nutrients that are included are calories, protein, vitamin A, vitamin C, and zinc. And a little bit later in this presentation, we'll cover specific foods that you can get good sources of these nutrients to best benefit you. We'll discuss goals for healthy eating. And this is healthy eating in general, so you can start eating this way prior to your surgery to have best results in your post-op healing, and you can continue this way of eating lifelong to live a healthy, balanced lifestyle. So taking a look at the image, the choosemyplate.gov, this is an image that should show you what each meal of the day would look like for your breakfast, lunch, and dinner, and to include all 5 of those food groups at each meal. We like to tell people if you don't think you can get all 5 food groups to aim for at least 3 of those food groups at meals, and then maybe fit in the other 2 food groups for snacks in between meals. On the left, you can see what servings are recommended per day. For fruits, 2 servings per day. Vegetables, 2 servings a day. Grains, 3 to 4 ounces a day. Dairy, 3 servings a day. And protein, aim to consume 5 to 6 ounces a day minimum. To go further into the Choose My Plate way of eating, we wanted to show you what serving sizes would look like for each food group. You can see for fruits, there's a variety of serving sizes there. So 1 cup of things such as grapes, berries, applesauce would be considered 1 serving, 1/4 cup dried fruit, 1 small apple, 1 large banana, or 1 medium-sized orange. Going down the list, you can see the different 1 serving examples of the food groups. Going down to lean proteins, showing some additional examples of 1 ounce of cooked meat or seafood, 1 egg, 1/2 ounce of nuts or seeds, or 1/4 cup of cooked beans. This next slide includes a sample of menus that is straight from the choosemyplate.gov website. And that is a great resource for recipe ideas, or if you need some meal ideas to eat a little bit healthier, including all of those food groups into your daily meals. So looking at day 1, breakfast would be a peanut butter raisin oatmeal with 1 cup of orange juice. So you're getting the protein from the peanut butter, the fruit from the raisins, grains from the oatmeal, and that orange juice would be considered a fruit serving as well. Moving down to lunch for day 1, a tuna cucumber wrap with low-fat yogurt and 1 cup of low-fat milk would include your grain from the tortilla, protein from the tuna, vegetable from the cucumber, and your dairy sources from the milk and yogurt. So you can see that each of these meal ideas includes a variety of the food groups from the My Plate to make sure that your body is getting enough nutrients for both everyday living and post-op healing. Moving on to this slide, we'll further discuss those power foods that we included on the first slide that are specific for wound healing, starting with protein. Protein helps to build and repair muscle, skin, and other body tissues, and therefore very helpful after wound healing, after you come out of a surgery. We recommend choosing at least 1 protein source with each meal and snack. That could be something like meat, beans, poultry, fish, Greek yogurt, cottage cheese if you're a vegetarian or a vegan. Tofu and soy products are also excellent sources of protein. Vitamin C can be found in a variety of fruits and vegetables, as you can see here, some including citrus fruits, tomatoes, bell peppers, potatoes, cauliflower, spinach, and Brussels sprouts. Vitamin A can also be found in different fruits and vegetables, including your dark leafy green vegetables, also found in fortified dairy products and fortified cereals. So most of your dry cereals you would buy at the grocery store would include vitamin A as a fortified nutrient. Same with zinc. That is another place you can find it, are those fortified cereals, red meats, and seafood. So trying to get a combination of those foods after surgery can help to promote wound healing. Next, we'll talk about fiber and wound healing. After surgery, you'll likely be taking some sort of pain medication, which can sometimes lead to constipation. To help prevent constipation, increasing your fiber intake can be helpful. Fiber also has other health benefits, including heart health, weight management, and blood sugar control. So again, it's a nutrient that you can continue throughout your post-op course. Some high fiber foods to include after surgery to prevent constipation would be whole grains, such as whole grain bread, whole grain pasta, tortillas, brown rice, fresh fruits and vegetables, oatmeal and cereals, looking for cereals with at least 4 grams of fiber per serving, beans, and legumes. And another thing to think about when increasing your fiber intake is making sure that you also increase your fluid intake as well to help really bring on the benefits of that fiber. So whether that's from increasing your water intake or other fluids throughout the day. After surgery, you may find that you have poor appetite and just don't feel like eating. And this is normal, and hopefully it passes a few days after surgery. Try your best to still continue eating nutritious foods during that time to fully benefit from nutrition and wound healing. If you are unable to consume enough calories after surgery, eating calorie-dense foods when possible can be helpful. Listed here are some ways to sneak calories in your diet if you feel you are unable to eat quite enough to meet your needs. Eating small, frequent meals throughout the day can be helpful, so it doesn't have to be those 3 big meals that maybe you're used to, but just eating a small snack every 3 to 4 hours, such as cottage cheese with fruit or peanut butter with crackers, just something to give your body nutrition throughout the day. Cook with oil instead of cooking spray. Oil has a lot more good calories in it than cooking spray would, so in times that you've got poor appetite, that might be a helpful thing to try to do. Choosing high-calorie snacks such as nuts, nut butters like peanut butter, almond butter, seeds, and avocado are all great choices. Choosing calorie-containing beverages such as juice, milk, or even nutrition supplements such as Ensure or Boost. Using heavy cream instead of non-fat dairy creamer. Again, just a simple way to add extra calories. Using real sugar instead of sugar substitute, or using real butter instead of not the low-calorie spreads or sprays. The last thing we'll address are diabetes and high blood sugars with wound healing. It's very important to continue monitoring your blood sugar levels if you are someone with diabetes post-op. When our blood sugars are not in control, it may prevent proper wound healing and it could cause infection. So having good control of your blood sugars levels will help to prevent those things. So with that, I hope you have a little bit of a better understanding of proper nutrition for wound healing. If you have any further nutrition questions, you can email me directly at the email listed here, or you can call the dietitian office phone number 319-768-3431, and one of us dietitians would be happy to help you.